What I may ask is those that are in the lobby, we're getting ready to get started. Thank you. On behalf of the Boys and Girls Clubs of Boston, we want to welcome you here this morning. We're honored to host you here at the Yawkey Club of Roxbury, as well as acknowledging our Executive Director, Corey Manning, who is here to the right. And thank you, Corey, for hosting. As we release the Boston Life Expectancy Report as part of the Boston Public Health Commission's Live Long and Well agenda, I want to start by just acknowledging and thanking our Mayor, Michelle Wu, for her leadership and partnership. Also, Dr. Basola Ojakudo, the Commissioner of Public Health, and her entire team for driving this critical work forward. We're also grateful to be joined by Magnolia Contreras, Vice President of Community Health from Dana-Farber Cancer Institute, as well as Frank Farrell from the Mayor's Office of Black Male Achievement, who you'll be hearing from this morning. We also want to welcome our city councilors. There's my man, Councilor Culpepper, and Councilor Santana, as well as Councilor Jean. I didn't see you walk in. Great to see you this morning, and so many other friends and partners about this critical work. You know your presence and your leadership matters. We're gathered here because the data tells a story, and today's report tells us something that we cannot ignore. And again, we're having a press conference here today, but we have to leave here and capture all of this information we have, because it's going to take a collective group like all of us as we continue to move forward. In Boston, life expectancy is still shaped by race and by zip code. That reality is not abstract to me as someone who grew up in East Boston and then the South End. I've spoken about the stark life expectancy gap between neighborhoods like the ones I grew up with in the Back Bay and communities just a few miles away from here. Where you live should not determine how long you live, but too often in our city it does. At the Boys and Girls Clubs of Boston, we see the roots of that gap every single day. Health outcomes are connected to academic opportunity for us, to safe spaces for our young people, to access to trusted adults, to financial stability, and to workforce pathways. That's why we're proud, very proud, to be a Live Long and Well grantee in partnership with the Harvard Street Neighborhood Health Center. We're training Boys and Girls Club alumni as Link Health certified patient navigators who will screen thousands of Dorchester residents for financial assistance benefits, unlocking an estimated $11 million in resources for our families. We know this. That's not just healthcare access. That's economic mobility, dignity, and prevention. Closing the Black life expectancy gap requires all of us, public health leaders, city officials, community organization, residents, our young people, working together with urgency and intention. Thank you for being here, for your commitment to building a Boston where every child, every family, and every neighborhood can truly live long and well. Now it is my honor to welcome our great mayor of the city of Boston, Mayor Michelle Wu.
Thank you so much. Good morning, everyone. Good morning. Thank you so much to the incredible Robert Lewis Jr., someone who embodies Boston through and through. For me, there's no higher compliment than that, and someone whose work across every part of your career has reshaped our city, and we're so grateful and thankful to partner with you in this role as you are effectively creating more public infrastructure, more connections, more focus on our young people and community. So thank you for all that you do, and to all the Boys and Girls Club. Thank you to Corey as well for your leadership. It's always great to be back here. I feel like I've, in the last month or 2 months, done an event in every space in this in this Yawkey Club, and we're so thankful for all that you partner with us on and many, many initiatives in the city. And quick shout out as well to my fellow colleagues in elected office who were recognized, Councilor Lejeune, Councilor Culpepper, Councilor Santana, champions and warriors for what we need to do for our city, and always great to be with you. I want to lift up a few, there's many in the room, but some of our city colleagues, folks from the administration who are working hard every day and whose collaboration has made this possible. So shout out to our Chief of Equity and Inclusion, Maria Angeli Solis Cervera, they're back in the corner. Our Chief of Community Engagement, Brianna Malor. Our Chief of Human Services, Jose Masso. Our Senior Advisor and Director of Violence Prevention, Dr. Isaac Yablo. We have our Chief of EMS, Jim Hooley. Okay, now I'm just grasping because I know I'm panicking because I'm missing people who are not written on my list. Chief of Policy, Kristen McSwain. Our Roxbury liaison, Asha Janae, is here in the house as well. Thank you for being the eyes and ears in this neighborhood. Okay, and I see our Senior Advisor for Racial Justice, Lori Nelson's in the house as well. And many, many, many of our team members. So apologies, I love you all, and I'm honored to work with you every single day. And of course, the folks who are sitting on the stage with me here, Frank Farrow of our Office of Black Male Advancement, and our incredible Director of the Boston Public Health Commission, Dr. Pasola Ojikutu, whose leadership and vision and whose team help steer the way, not just for Boston, but to be a beacon nationally. So we're here because of your leadership. Thank you. Finally, everyone in this room deserves to be thanked and recognized for your partnership. I do want to ask a special group to stand because they have joined us here today as we are debuting a new depth of partnership for many folks who've already been partnered with the city for a long time. But with Dr. Ojikutu, we've created a Mayor's Live Long and Well Advisory Council to officially steward this work and make sure we're grounded in community. So could all of our advisory council members who are here please stand? And if you could, if everyone could just introduce yourselves with your name and title. I want to make sure everyone knows and this is our entire council, but a bit of the breadth and depth of expertise that we have. Maybe Abigail, could you start?
Good morning. My name is Abigail Forrest. I'm the CEO of the Expectancy. Good morning, everyone. Chief Vice President of Mission and Associate Chief Medical Officer at Boston Medical Center. Good morning, Juan Fernando Lopera. I'm the Chief Community and Health Impact Officer at Beth Israeli Health.
Good morning, everyone. I'm Elsie Tavares. I'm the Chief Community Health and Health Equity Officer for Mass General Brigham and the Board Chair of the Boston Public Health Commission.
Good morning, everyone. I'm Tori Burton, the founder and executive director of Dennis Pride Suicide Prevention and Family Support, Boston's first BIPOC-focused suicide prevention organization.
Good morning, everyone. I'm Winston Bodrick, executive director of Roxbury YMCA.
Good morning, everybody. My name is Dr. Sam William, Senior Vice President at Harvardson Neighborhood Health Center.
Good morning, everyone. I am Marilyn Foreman, Director of Community Organizing and Resident Engagement for the Codman Square Neighborhood Development Corporation.
Good morning, everybody. Royal Smith, President of Boston NAACP.
Good morning, everyone. Monica Ford, I'm the Chief Medical Officer at Dot Health.
Good morning, everyone. Sherry Dong, Executive Director of Community Benefits and Community Health at Tufts Medical Center.
Good morning, everyone. My name is Reverend Dr. Danny Gonzalez. I'm a pastor at First Baptist Church in Dorchester and I'm a chaplain at Washington.
Good morning, everyone. I'm Richard Clater of Rich Clater Consulting, but also a commissioner for the Commission on Black Men and Women.
Good morning, everyone. My name is Colleen Nguyen. I'm the Executive Director of Asian Women for Health.
Good morning, everyone. My name is Adriana Bolin. I use she, her pronouns, and I'm the Director of Racial Equity, Social Justice, and Community Engagement at Fenway Health.
Anise Abdul, for faculty at Northeastern University in Computer Sciences, and also affiliated with Time Home Care, local VNA located in Boston.
Thank you so much. Thank you for helping steward this work and for all that you do. And one more big thank you to each and every one of our community members, those in the room and those who aren't in the room at this moment, who keep showing up and keep pushing us as a city to do better for all of our communities and for Black Boston. Your leadership is helping to hold the highest standards and highest levels of services, of outreach, of community. And we know that despite what's happening in the world right now, despite the headwinds that are coming at us from even within our own government at different levels, Boston is going to be a city that does not back down for everyone having the lives that they deserve and for having a longer, healthier life be a reality for every one of our communities and every one of our residents. With that goal, a year and a half ago, we launched the Live Long and Well agenda, recognizing that systemic racism has created a public health crisis in our city. Boston is home to the best healthcare professionals and medical institutions in the world. Overall, our city has one of the highest life expectancy rates in the country. And yet, a resident in Roxbury dies on average 23 years before their neighbor in Back Bay. Black residents in our city pass away more than 6 years earlier than any other major racial group on average. So we cannot claim Boston as a beacon of healthcare while entire communities are left in the dark. A beacon that only shines for some is no beacon at all. It's just a spotlight. And we have the resources and the institutions to do better across the board. So at the City of Boston, we've made it our mission to close these life expectancy gaps by investing in the communities that need it most, expanding access to fresh food, safe, affordable housing, economic opportunity, and by partnering directly with the community members and organizations that know best what needs to be done. When we rolled out this agenda, we made a promise to eliminate race and neighborhood-based life expectancy gaps entirely by 2035. Today is a critical step toward keeping that promise. We're releasing a new report from the BPHC that shares data on life expectancy for Black residents in Boston. This will be the first in a series of reports addressing the unique challenges and health needs of diverse populations across our city. These reports help us focus our resources and be honest and candid about exactly where gaps in access still exist, so that we can build solutions that are actually effective, instead of defaulting to one-size-fits-all approaches that we already know might actually exacerbate inequities. If this report makes one thing clear, it's that we need more effective solutions, and we need them urgently. According to the data, overall life expectancy in Boston has increased over the past 10 years, but for Black residents, it has gone down. The gap between Black residents and the rest of the city has doubled. The numbers we're releasing today are not any that any community should stand for or tolerate. But this report also tells us that change is possible, that interventions can make a difference, and community involvement and focus can very quickly ensure that we're getting resources where they're needed. The report shows that we've already made real progress in reducing one of the leading causes of early death in Black communities, fatal overdoses. We did it by being specific, focusing on the neighborhoods most impacted and the residents most at risk, and developing tailored strategies in partnership with those communities. We've proven that the model works, and now we need more action and more resources. That's why today, in partnership with the Dana-Farber Cancer Institute, the City of Boston is investing $1 million to fight cancer in Boston's Black communities. This funding will expand access to screenings and boost community-based prevention so we can detect cancer earlier, treat it sooner, and save more lives. We're also committing an additional $1 million through the Boston Public Health Commission to support organizations focused on improving the health and well-being of Black men, who have the lowest life expectancy of any demographic group in our city. And to guide the implementation of these funds, we're proud to be hosting the Black Men's Health Activation Summit this June. I can see many of the leaders who are already helping us plan that summit are here today, so thank you all for being here, and thank you for the work that's going to lead to an amazing event and continue this momentum. Finally, to help steer all of this work, our Live Long and Well Mayor's Advisory Council will help guide city leaders as we take action on the Live Long and Well agenda. You saw and met some of them already, But this panel overall is a group of 30 respected community leaders whose input will ensure that every step we take is in partnership with advocates and community leaders already doing the work on the ground in our communities. So thank you all for stepping up. I want to give a special thank you to the Black Men and Boys Commission under the leadership of Frank and the various chairs. I know Madre's here with us today and Councilor Jackson before him. We would not be here today, certainly without the vision and the leadership of the Boston Public Health Commission, but we also would not be here today without the Black Men and Boys Commission and all of the research, all of the outreach, all of the national best practices that they have been gathering and sharing, pushing us to also make sure that we're doing everything we possibly can. So thank you for all that you do, and thank you for adding one more thing to the list of accomplishments that the Commission is helping us achieve. We have the research, we have the resources, and most importantly, we have the resolve to get this done. Now it's time to deliver. And so before I turn it over to Dr. Ojikutu to share more about the report, otra vez en español. Buenos días y gracias. Hace un año y medio, nuestra administración lanzó la agenda Live Long and Well porque entendimos que el racismo sistémico ha creado una crisis de salud pública en nuestra ciudad. En Boston, nuestra misión es cerrar estas brechas de esperanza de vida, invirtiendo en las comunidades que más lo necesitan, ampliando el acceso a alimentos frescos, viviendas seguras y asequibles y oportunidades económicas. Hoy estamos publicando un nuevo informe de la Comisión que comparte datos sobre la esperanza de vida de los residentes negros en Boston. Este será el primero de una serie de informes que abordan los desafíos únicos y las necesidades de salud de las poblaciones diversas en toda nuestra ciudad. Según los datos, la esperanza de vida general en Boston ha aumentado en los últimos 10 años, pero para los residentes negros ha bajado. La brecha entre los residentes negros y el resto de la ciudad se ha duplicado. Los números que estamos publicando hoy son completamente inaceptables, pero este informe también nos dice que el cambio es posible, porque demuestra que ya hemos hecho un progreso real en la reducción de una de las principales causas de muerte prematura en las comunidades negras, las sobredosis fatales. Lo hicimos siendo específicos, centrándonos en los vecindarios más afectados y los residentes más a riesgo, y desarrollando estrategias personalizadas en asociación con esas comunidades. Hemos demostrado que el modelo funciona. Ahora necesitamos más acción y más recursos. Es por eso que hoy, en asociación con el Instituto de Cáncer de Dana-Farber, la ciudad de Boston está invirtiendo $1 millón para combatir el cáncer en las comunidades negras de Boston. Esta financiación ampliará el acceso a los exámenes de detección y aumentará la prevención basada en la comunidad para que podamos detectar el cáncer antes, tratarlo antes y salvar más vidas. También estamos comprometiendo $1 millón adicionales a través de la Comisión de Salud Pública de Boston para apoyar a organizaciones enfocadas en mejorar la salud y el bienestar de los hombres negros que tienen la esperanza de vida más baja de cualquier grupo en nuestra ciudad. Y para guiar nuestra implementación de esos fondos, estamos orgullosos de organizar la Cumbre de Activación de la Salud de los Hombres Negros este junio. Finalmente, me complace anunciar el lanzamiento de nuestro Consejo Asesor de Live Long and Well, que ayudará a guiar a los líderes de la ciudad mientras tomamos medidas en la agenda Live Long and Well. Este panel está formado por 30 respetados líderes comunitarios que garantizarán que cada paso que demos sea en asociación con los defensores que ya están haciendo el trabajo en nuestras comunidades. Tenemos la investigación, los recursos y la determinación que necesitamos para actuar. Ahora es el momento de entregar. So thank you to everyone. I'm going to pass it on to Dr. Bisola Ojikutu, Executive Director of the Boston Public Health Commission.
Okay, good morning, everyone. I am so excited to be here. You know, many cities release data, but few actually catalyze action. Few create change. And we've seen this across our country. So I'm not underestimating what we're doing. It is incredibly important that we're here today in this room. So thank you, Mayor Wu, for your leadership and commitment to the residents of Boston. And also thank you to the Boys and Girls Club for hosting us. Thank you, Robert, for your outstanding leadership across many sectors and being a support for much of the work that we do. Thank you to all of you who are, people who I know. I see a lot of faces who I'm familiar with, a lot of friends. But I also noted, a lot of the people who stood up for our mayor's Live Long and Well Advisory Council, these are new faces. And we're bringing new people to the table. We're bringing new voices. And we're really going to do things that are different. And I think that's what's important. So as the mayor stated, a few years ago, the Boston Public Health Commission released data showing a 23-year life expectancy gap between a neighborhood in Roxbury, that neighborhood is actually right next door to this neighborhood that we're in right now, and a neighborhood in Back Bay. And when that came out, I think everybody was surprised. It was stark and jarring data. And in response, we launched Live Long and Well, our city's commitment to closing these gaps, analyzing our data, and acting on our findings. So here's the specifics of what we found. In the last decade, the life expectancy gap between Black residents and their neighbors doubled, growing from 3.3 years to almost 7 years. Data from 2022 to 2024 show that Black women in Boston had an average life expectancy of 80 years, which is approximately 6 years lower than their counterparts of other races and ethnicities. Also, data from 2022 to 24 show that Black men have the lowest life expectancy of all racial and ethnic groups. Black men live approximately 72 years of age, which is more than 9 years lower than men of other races and ethnicities. And our modeling studies show that if we take no meaningful additional action to reduce inequities, 10 years from now, the life expectancy gap will remain the same. Okay, so when you hear these numbers, I'm sure they're concerning. You should be concerned. But this is not about numbers. This is about people. This is about your neighbor who dies at age 50 from breast cancer, and not because that breast cancer was so incredibly aggressive, but because screening was delayed. This is about the young man who is living on the street a block or two from here, in the middle of Nubian, who overdoses alone in a doorway at age 30. This is about your mother who was diagnosed with diabetes at 45, had a heart attack at 60, and then never recovered from a stroke at 71. This is about our families, our communities. This is about us. So why are Black people dying earlier than our counterparts? Well, number one, unintentional drug overdose. Number two, screenable, many preventable cancers, breast, colon, and prostate primarily. And number three is cardiometabolic disease, heart disease, and diabetes. But what are the real root causes? And Robert spoke to these. We're talking about deficits in social determinants of health. We're talking about limited economic opportunity. We're talking about poor housing. We're talking about the nature of some of our communities. And we're talking about community violence because number 4 on the list for Black men is homicide. This is not just a Boston problem. This is not unique to Boston. This is a national problem. And though our federal leadership has made equity a bad word, we believe that health equity, ensuring that everyone has a fair and just chance to be healthy, is a right and not a privilege. It's a core value, and it's something we should all believe in. So these problems are solvable. These are not insurmountable problems. And as the mayor mentioned, we've had success in lowering fatal overdoses in Boston. And a lot of that is because of our targeted, community-informed work. And last year, we announced a partnership with Atrius Health Equity Foundation to address root causes of cardiometabolic disease, like heart disease and diabetes. And today, with the investment that the mayor just mentioned from our partners, Dana-Farber, we are going to make it possible to increase cancer screening and prevention throughout the city of Boston. And I'm also very proud of our commitment of $1 million that will go to community-based organizations that lift up and fulfill the needs, build resources to actually address Black men's health here in Boston. So I believe the mayor also already mentioned our Black Men's Health Activation Summit that's coming in June. This is going to be an opportunity to really bring leaders together, to think creatively, to come up with innovative ideas to address these issues. And I think it's actually going to help us inform how we're going to spend that $1 million. I don't want anybody to feel as though we're not committed to our focus on women's health, because I did say that Black women live significantly lower than our counterparts. Severe maternal morbidity and chronic diseases like diabetes and preventable cancers disproportionately impact Black women in our city and nationally. We are working very hard to strengthen our work, and we are going to move some investments forward in that area, as well as amongst Black men soon. So I want to thank all of you in this room for being here with us, for being committed to this work, for being dedicated, for doing what you're doing, and for being willing to think differently about how we do things, because we need to think differently. I also want to thank my staff, because they've really worked really, really hard on pulling this data together, pulling this event together. It really, truly is commitment that's leading the way. So now I want to introduce Magnolia Contreras. I said commitment. I think she is one of the most dedicated health equity experts in our city, and I want to thank Dana-Farber again for all of their work. So Magnolia.
Good morning. I think we need more press conferences like this. When you're with family, it feels so good, and I think all of us can enjoy being in each other's space more often. Mayor Wu, thank you for your commitment to the health and well-being of all residents of Boston. Your leadership in the public health system that we've created is what allows us to be here today. And as I said, we need more of these spaces, so thank you for your leadership. Robert, thank you for hosting us here. You are so important to us. You are a convener for us in all aspects of our city in Boston, so thank you for your continued leadership. Dr. Ojokutu, what can I say about you? Thank you for the vision that brings us here today. The focus on our longevity allows us to redefine public health in a moment when people think that they don't know what public health is. We've brought a new definition: longevity. People living well and people living long. That's our new definition of public health. It makes it easy, accessible, and we don't have to talk about why it makes it challenging for people to understand that. So thank you so much for doing that. And followed by the closing of the GAP report, we are not just saying that we're going to focus on longevity. The report is going to serve as a blueprint for all of us in different sectors to follow, to see our efforts, and to collaboratively and collectively work towards the same outcome. I don't know what we would be doing without Dr. O in Boston right now, so I appreciate you so much. Thank you, thank you. I also want to acknowledge the Boston Community Health Collaborative and the members that are here today. Many of you may not know that group, but that group is a membership group of hospitals, community-based organizations, YMCAs, CDCs that come together on a regular basis to try to address both health and the social determinants of health in the city of Boston by working together to create the community health needs assessment for the city of Boston and the report that says how we are all going to work together, which we refer to as a CHIP. And I just want to give a shout out to Tabrini, Crystal, and a new colleague that joined us recently. Thank you for the work that comes in that report. At Dana-Farber, we have a number of programs that address the needs of our communities before they have cancer. A lot of the work that we do is community education. We have community outreach workers that partner with many of you to bring basic cancer information to the community so that they know what they need to do, how they can participate in reducing their own cancer risk. We also have patient navigators in our building in each of the disease centers who help folks in our communities navigate the challenge of being diagnosed with cancer. And they work with our patients throughout the cancer experience and beyond. So this partnership that we are launching today is really one that is a foundation for so much work that we have done. I want to acknowledge my colleagues in the Public Health Commission and I'm going to call them the cancer team, Mark Kennedy, Mary Bovenzi, because we have worked together to move the cancer needle for decades. The contribution that Dana-Farber is making to the Public Health Commission Live Long and Well agenda, $1 million to address cancer prevention, screening. That is one of the primary issues that our community health needs assessment found, that we need to double down and ensure the folks have the information and access to screenings where they are possible. In this funding, this partnership, the advisory council is really going to let us know how we can make those funds move faster and provide more accessible screenings to everybody here in the city of Boston. We know that one of the top leading causes of premature mortality for Black people is cancer. We have been reporting this in our cancer needs assessment after assessment after assessment, and we could not be more thrilled that we are now harnessing the power, the intelligence, the love that is in this room in order for us to do more impactful work in that regard. And we are so ready for it, and I just want to thank you, and we look forward to the work that's going to be ushered by the advisory committee. Thank you so much.
Good morning. I stand before you as a Black man born and raised in Roxbury in this neighborhood, and we made a lot of strides kind of through the Office of Black Male Advancement in partnership with the commission, but it's tough to see the data. You know, Black men have the lowest life expectancy, but it's not new to us. We've lost friends, we lost loved ones. There are names that are connected to this data. But I'm proud of the partnership and the work that we are doing now to ensure that the data is leading to policy, programs, initiatives, and we're connecting funding to it. Because we have to invest in what the needs are. And the data is showing the population that's most in need are Black men. Oftentimes we get into spaces and we're afraid to say the real thing. We're afraid to say that we need to invest resources, we need to invest in supports and intervention for Black men, for Black boys. And so, as the Executive Director of the Office of Black Male Advancement, I just want to thank everyone here for saying that we're committed to investing in the resources and the supports and needs of Black men and boys so that they can survive, but most importantly, that they can thrive in the city of Boston. So I want to share my appreciation for our Mayor, Michelle Wu, for her leadership in entrusting us to move the work forward. Grateful for Dr. Basola Ojikutu, the Boston Public Health Commission, and their entire team for welcoming us into the space, for listening to us as Black men to share what we need, but also to be collaborative and not only pull in us in the city, but community partners, community leaders, and centering community voice, because those with the lived experience should always be at the table when decisions are being made. So again, want to thank our community partners, the Boston residents whose lived experience guide this work. Through the Office of Black Male Advancement, we're dedicated to addressing systemic barriers, improving outcomes, and empowering Black men and boys across Boston. From its inception, the office has centered its work on supporting the community's capacity to build and sustain not only generational wealth, but generational health. This data from the Health Commission shows that Black men are not living as long as they should. And this data has to be taken seriously, and I'm glad that we are taking it seriously and integrating into the policy recommendations and designing programs that will curtail the narrative. I'm thankful that we have worked with the Commission on Black Men and Boys in partnership with the Health Commission for these past couple of years to have critical investments in the fatherhood initiatives, mental health initiatives, work around Office of Violence Prevention. And now, as we continue this work with the Black Men's Health Activation Summit and this commitment of this $1 million, I want to share that this is only the beginning. We have to invest deep, and we have to invest urgently because this is critical, and we have to improve the outcomes. The Mayor's Office of Black Male Advancement stands firmly in partnership with the Health Commission to confront health disparities of Black men and boys and families across Boston. The Health Commission's effort to close these gaps in life expectancy among Black residents is guided by community voice, grounded in data, with the focus on developing long-term solutions through collective action. It is critical that we continue to build a comprehensive plan to improve quality of life and ensure every resident has resources to live long and well in the city of Boston. And I look forward to continuing to work in partnership with the Health Commission, with all of you. Let's make sure today is just not a day, it's not a moment. The data is real. We can't hide from it. We have to own it, and we have to start to make sure that we're closing these gaps. And if we're not making the changes that need, then we come back to the table and we continue to figure out what we need to do to make sure that we're improving the outcomes for all Boston residents. So thank you to everyone. Glad that everyone's here. Just make sure you continue to stay at the table because it's all hands on deck right now. Thank you.
Thank you again, Frank. Thank you to Frank for your leadership, and thank you to each and every one of our commissioners, past and present. I also want to give a shout out to Dr. Kevin Simone, who is the Chief of Behavioral Health for the City of Boston and Boston Public Health Commission. Thank you for your work on the very important mental health initiatives. And then to wrap us up, not to put them on the spot, I wanted to invite up all of our partners on the council to come up together and just share a word as well. All three can come up at the same time.
While they debate who goes first, I'm just going to say good morning, everyone. Ruthie Louis-Jean, at-large city councilor, and I just want to thank this incredible team for being here. I think it was a year ago when we were announcing the Live Long and Well agenda, and I just want to echo what Frank said. And Frank, I want to thank you for your powerful, emotional, and honest words, because the data, there's a person attached to each data, right? There are neighbors, there are people we know, they may be us. And so the changes that we need to make sure that our dollars, our budget, right, we are about to start the budget process, reflects the things that we care about, what we value the most. And we have a responsibility and obligation to not just sit in the sorrow of the data, but to take action and make sure that we're closing these gaps. So thank you, Mayor, for your leadership. Dr. Ojikutu, who is always just being a problem solver. And I don't know where the city would be without the vision of a Black woman really leading the Boston Public Health Commission. So, want to shout her out, want to shout out Dr. Simon, want to shout out everyone, so many bad mama jammas in this house. And so I just want to thank you, because this is, even though the data is sorrow, this room is hopeful. So thank you. And thank you, of course, to the one and only Robert Lewis for all you do for our city. Thank you.
Morning, everyone. Henry Santana here, at-large city councilor. And I feel very hopeful after this press conference. I think, as Frank said, the numbers are there. The doctor said, right behind those numbers there are people, and there's one elected official that I thought about today a lot while sitting here, and that's our Congresswoman Ayanna Pressley, who's always says our young black boys and girls deserve to grow old, and that's what I do this work for. I'm someone who grew up in Mission Hill in public housing, and right now I have sciatica, so I'm like leaning and hurting, and I just turned, I turned 30 last October, and I deserve to grow old too, right? So I'm committed to this work. I'm committed to these individuals. So many of the people who do that work are right here in this room, and I'm just so grateful. I want to be able to connect and stay committed to this work. Again, as our Congresswoman says, our young black boys and girls deserve to grow old, and I'm committed to that. Thank you.
Good morning. Thank you to the Boston Public Health Commission, Dr. Oja Kutu. Thank you to our mayor. Thank you to Magnolia Country and Frank. And I couldn't forget Robert Lewis, especially one that grew up in this Roxbury. At the time, it was the Boys Club, but it's now the Roxbury Boys and Girls Club. And every time I come here, I feel like I'm coming home. And when I think about where we are today, and the community leaders, researchers whose work made this report possible, the findings we are discussing today require us, as Frank said, to confront a painful truth. In Boston, you've heard a black child born in Roxbury can expect to live 23 fewer years than someone just a few miles away in Back Bay. 69 years compared to 92 years. And that gap is not just a statistic. It reflects deeply the inequities and the conditions that shape people's health and opportunity across a lifetime. Black residents in Boston continue to have, as has been discussed this morning, the lowest life expectancy of any major racial or ethnic group in the city, and the gap has grown over the past decade. We should be clear, this is not about biology, it's not about personal choices, it's the result of long-standing inequities rooted in racism, community disinvestment, and unequal access to resources. As chair of the Boston City Council Civil Rights Committee, I believe this report reminds us that civil rights must be understood broadly. We rightly honor the pillars of the civil rights movement, voting rights, housing rights, and equal opportunity, but health, longevity, and quality of life are civil rights issues too. Black families are often the canaries of the coal mine when it comes to public health crises, hit first and hardest by systemic inequity. But when we design policies of care, everyone benefits. I represent District 7, one of the most diverse districts in Boston and one that runs through the heart of the city. What I know from representing the community is that well-being of one neighborhood is connected to the well-being of them all. Regardless of where neighborhoods fall on the life expectancy journey, we should all want our neighbors to thrive. So today, I invite residents, institutions, and leaders across Boston to stand, and I thank God for all of these leaders on this panel to stand for the communities most impacted by these disparities. Because when we care for those who suffer the most in our community, we're doing the work of justice. The investments announced today through the Live Long and Well initiative are an important step forward. And together we can build a Boston where a person's life expectancy is not determined by their race or by their zip code. And I want to just close on this, because Dr. Ojukwu, did I get it right? Because I don't want to mispronounce her name because of the work she's doing. But she talked about screenable and preventable. And when I think about my life, screenable for me and preventable, without it, I would be a statistic. I remember in 2014, I went to the doctor for a screening, yearly screening, and the amazing thing is I have health insurance. Many don't in our community, and I go for a yearly physical. And my doctor is so careful. He saw my PSA go up to just 0.1. He said, we're sending you to go get a checkup. They ended up doing not just looking at the PSA, but they did a biopsy. And when they did the biopsy, they saw that I had prostate cancer. Because of some of the best doctors, they were able to detect it early. And so when I went in with the surgeons and we talked about what I was going to do, what I was needed, when I would need it, how I would have it, I also had a colonoscopy scheduled. And I said to the doctor, I'm not going to do that. Let's get on with the PSA stuff. Let's get on with the prostate. And he said, no. He said, no, let's just do the colonoscopy. And when I went in for the colonoscopy and I sat with the doctors, and the doctors would smile, and they said we might find a polyp or two, and if we find a polyp or two, we'll take the polyp out. And so they did the colonoscopy. And after the colonoscopy, they send you into a recovery room. And when the doctor came in and he looked at me, he had turned yellow. And he said to me, we had to do a biopsy, and we had to tag where that colon cancer was. Now, if I didn't have the doctors that I had, if I didn't have the health insurance that I had, I never would have found out that I had prostate cancer and colon cancer at the same time. Within 2 weeks, they had taken out a foot of my colon. That was in 2014. And the reason why I say that to you is because I wouldn't be here today if I didn't have the kind of health insurance, I didn't have the kind of access to screenable and preventable health care. So when I think about where we are today, and I look at what the Lord is not through with me yet. We've got some work to do. And so let me just say thank you to everyone on this panel. Thank you to the summit. Thank you to those that are on this established committee, because we've got work to do. And as the doctor says, it's preventable. We can do it together. We can stand together, and we can fight for life, because it's truly about life. It's about saving life. And so when I look at the leadership that we have here, we can do it. Together, we can save lives. God bless you, and thank you.
All right, no more to add after that. Thank you all for coming.